My name is Dr. Joseph Zagami, and I am a prosthodontist. I was trained at New York University, where I received my DDS degree in 1985 and my postgraduate training in prosthodontics in 1993. Prosthodontist is a specialist in crowns, bridges, implant restorations, full mouth rehabilitations. We also have subspecialties in maxillofacial prosthetics and also implant dentistry. What makes me unique as a clinician, I had excellent training. I went to one of the top dental schools in the country, and I was taught by some of the top practitioners in New York City. New York University offered me an experience to treat a large group of patients, and having been exposed to the leaders of dentistry, I feel that that was probably the most important and most significant. The difference between a general dentist and a prosthodontist is really in years of training. A general dentist is 4 years of dental school. A prosthodontist will follow the same path, and it will also include anywhere from 2 to 3 to 4 years of additional training for a specialty degree. As a prosthodontist, having an expertise level makes me even more committed to some of the more difficult and more challenging patients, and I find that the gratification that they see when they leave with a healthy and functional smile is really why I do what I do as a dentist and a prosthodontist. I had a very, very positive dental experience growing up. When I was a little boy, about 8 or 9 years old, I also had some cavities that needed attention. My mom would take me to the dentist, and I was very curious. I'd look around and see all the tools and the technology that was there in those days, and it just made it very, very interesting. Of course, my love for science and math and biology helped me groom this direction. Once I got into dental school, I realized that it was a really, really good fit, and I guess that positive experience, and that's one of the things that I really try and impose on my patients, is that yes, there are difficult things that we do in dentistry, but if we can get you through that and see the light at the end of the tunnel, we walk with them, and they feel very blessed. And I think part of where I came from is transferred to those patients, and they really see that. I can speak to them, and they can sense the compassion that I have, the love for dentistry. I think it comes through when I do speak to my patients. They appreciate those things. And I also like to interject some personal stories to make them feel relaxed. Let's face it, no one likes to come to the dentist, whether they're a prosthodontist or whatever. We happen to be the end of the line dentist because patients come to us with lots of difficult challenges, and to ease their stress and make them feel comfortable and know that they have an answer here, I think it's an important tool that we can provide for our patients.